Good afternoon.
Good afternoon.
Honorable David Sater and members of the Healthcare Policy Committee, thank you for hearing me today. I'm here to testify in support of HB 1405. My name is Mimi Signor, RN. I'm from University City, Missouri. I work as a staff nurse in a large urban St. Louis hospital. I speak in behalf of my patients, many of whom come for care from all parts of Missouri. I'm wearing two hats today. I'm a nurse now. HB 1405 includes comprehensive preventive care which would result in improved health and productivity for all Missouri. The goal of any health program must be health. Those who are unable to get health care suffer more and die sooner. Missouri, whose motto is "Let the welfare of the people be the supreme law," must not embrace any health plan that would deny or ration care according to ability to pay. Out-of-pocket costs include premiums, deductibles, and co-pays, which are financial barriers to care. There's no sensible argument for rationing health care. Everybody needs it. 1405 is a single publicly financed health program to benefit all Missourians. Healthcare dollars would be spent on health care. The austere financial deficit we face mandates that a health plan must be the most fiscally conservative plan to provide health care for all who need it. Every study by the federal government and by the states include that a universal single-payer program saves money. Missouri could afford statewide universal health care and reduce overall spending by $1.7 billion through low administrative costs and streamlined billing in a single-payer program, according to an unbiased, independent study funded by the Missouri Foundation for Health. This is the study. I have 12 sets of the results for you as handouts. The Missouri Universal Health Assurance Program was actually written in 1990 with principles of public administration, universality, portability, comprehensiveness, and accessibility. The bill was actually passed out of committee, debated, and voted on in 1990. The bill has been revised over the years. We think it's the best to date. I have bill highlights and another handout for all 12 members of the committee. Did you have any questions?
Thank you. Any questions for the witness? Seeing none, thank you very much.
Thank you.
Anyone else in favor of this legislation?
I have some written materials for you as well.
Thank you.
So I've met most of you before. I'm Dr. Greg Flashfire. I'm a family physician in St. Louis. I'm also the chair of the newly formed St. Louis chapter of Physicians for a National Health Program. We're 18,000 members nationally and growing in St. Louis. We are the group that advocates for a single-payer program nationally, a publicly funded but privately delivered program so we could all keep our own physicians. It does not change the delivery model. It's only focused on changing the payment structure. We believe that this sort of program, much like they have in Canada, would probably start as it did in Canada in individual states across the United States. After the chase, medical insurance companies, as you understand them, are primarily intended, not as a side effect, but primarily what they do is introduce restrictions on consumer choice. That's what health insurance companies do. They introduce restrictions on consumer choice. We have hundreds of networks of physicians around the state based upon medical health insurance. You have to go to one and the one that your employer picked. We have hundreds of drug formularies across the state. Again, you can only get the drugs that are on the formulary that your employer picked. I know many of you run into that problem yourself. The bill that's before you would introduce complete choice of physicians, and it would solve the problem of hundreds of formularies in the state. Secondly, as a physician, like most physicians, I'm concerned about medical malpractice. If you think about it, most malpractice judgments include primarily the cost of future care. Since that would be rolled up into this, the cost of malpractice would plummet under this plan. Put all these things together, and 59% of physicians across the country support a program much like HB 1405. 59% of physicians nationally. I don't have a number for that for just Missouri. Lastly, this is a pro-business approach. Gallup poll just this week of small business owners said that 48% of them said that they are avoiding hiring people because of concerns about upcoming healthcare costs. 48% of small businesses said that they are, and this would address that concern, it would offload it from them. All industries would benefit from this bill, except of course for the health insurance companies who would be excluded from providing this care, and for drug and device manufacturers. Other than them, every other group and every other industry in the state would benefit in the health employment. Close with this quote from Forbes magazine, that bastion of left-wing thought. Forbes magazine, April 6, 2012, the issue before the current one, said that if states adopted single payer, that they should expect a flood of new businesses into the state because of making this is so much more business friendly. And that material is in my material.
Thank you very much for your testimony. Questions for this witness? Yes, Representative.
Two-part.
See.
So are you telling me that you think the Canadian healthcare system is better than ours?
Not in every way. We have definite aspects of our healthcare that are better than theirs, and we would not want to just adopt the Canadian system. We can do it way better than they're doing it. However, in some ways, they're infinitely better. They don't have the problem of medical bankruptcy. Most bankruptcies in the United States, I think 60%, something like that, bankruptcies in the United States occur because of medical problems that started, and 75% of the people that occurs to had health insurance when their disease started. So medical bankruptcies, health problems are causing bankruptcies, are the biggest cause of bankruptcies among even insured people. This bill would solve that. Canada solved that. There's other advantages too, but time is short.
Maybe we need to change our bankruptcy laws.
That would be another aspect of the solution.
Another question too. You talked about 48% of small business employers are holding off on hiring people because they're afraid of what the insurance costs are going to do.
That's what the Gallup poll that came out this week
Do
said.
you think that might have any relation to the healthcare, federal mandate healthcare plan?
I don't know. I do know that this problem is described as being more, the HB 1405 could be described as being more affordable than the Affordable Care Act.
Thank you.
Further questions? Yes.
To inquire.
See.
I don't know if this is for you or for Representative Brown. It says this is going to be financed through a health care assurance tax based on Missouri adjusted gross income. Do we have any guesstimates on what that tax would look like?
Actually, that tax is, that's articulated in the bill and would average about 2% of an income tax.
Gross income.
Of Missouri state gross income.
The average cost of health care that you're paying now is $12,000 a year. With this 2%, it would be like less than $2,000. So I'd have to double check the numbers, but it's an income-based way to pay for this. Everyone shares the pain. We all get covered. What kind of great students and workforce can we have if we don't have to worry about being hurt?
That will cover their dependents also?
Yes.
95% of people would pay less than they do today.
Okay, thank you. Any further questions? Seeing none. Anyone else in favor of? We've got about 3 or 4 minutes.
I am Dr. William Kincaid. I'm also a member of the Physicians for the National Health Plan. And I'm here to speak in favor of the bill.
I can't hear you, sir.
I know time is of the essence here, but my career covered both practice as well as public health, as well as I was a director of managed care plan, Medicaid managed care plan back in the early 90s. So I've seen the healthcare system from a variety of different vantage points, and having a single system that everyone can access is extremely important. There's a huge cost for uninsuring patients. They come later into the system, cost more money. We don't prevent problems we could easily prevent. So I think what this bill does is decrease costs, it will increase coverage, and it will also create a healthcare system. And I'm pleased to see that there's some special issues in the bill that will deal with the problems of people who are poor and underinsured and have difficult time now getting access to the system. Getting transportation to a physician's visit is easy for you and I and most of the people in this room. It's very difficult for someone who's poor. So making sure that you can get to the services is extremely important as well.
Okay, thank you very much. Questions for this witness? Seeing none. Thank you.
I'm Joseph Beggin from Baldwin, Missouri. This is my wife, Suzanne, and I'm going to probably speak a little bit for both of us. My wife's been fighting cancer for 4 years. I've been fighting insurance companies for 4 years. And if you don't believe it, I'll give you last year, just as an example. Our medical cost last year was $197,000, of which my secondary insurer, Medicare paid a lot of that. My secondary insurer, who by the way, retiree, is from one of the world's largest drug companies, paid a grand total of $361.20. That's after me paying them $6,000 plus, and whatever my retiree paid them. What's to be learned out of all this? Well, number one, cancer is terrible. But working with private healthcare insurers makes it even worse. Number two, private insurers are in the business to make a profit, and they make it by not paying for services. Number three, read your EOBs, your explanation of benefits, very carefully, although I doubt many of you could even read them and understand them. I have the advantage of having worked with them, so I can. The last thing is you can make a difference by supporting this House bill and making sure that people get the care that they should get, and that they don't have the stress of wondering whether they're going to go bankrupt in getting it. There's that old saying, dear but for the grace of God. Well, don't fall out of grace with God, because you're going to go to insurance hell if you do.
Thank you very much. Into that. You had just a few comments.
All right, I'm his wife. I'm Suzanne Hagan. I'm a retired doctor as well as a cancer patient. So I've seen this system from every angle. Let me tell you, when I was in practice, I thought that single payer health insurance was the only way to go. And now as a patient, I'm truly convinced that I do have to mention the Missouri Foundation for Health's recent publication. They financed a study that was supposed to bend the healthcare spending curve. I was very disappointed to read this study. What did they do? They trotted out the old bromide of managed care. Let me tell you, managed care has never saved anybody a nickel. Studies have shown all over that Medicare managed care actually costs more than just straight Medicare. Managed care just puts an insurance company between the patient and the doctor. The Affordable Health Care Act is not really affordable. It keeps health insurers in there. They are allowed to make up to a 20% profit. I really think this is obscene, since Medicare's overhead is maybe 3 to 5%. So I urge your support for House Bill 1405. Thank you.
Thank you very much. Questions for either one of these witnesses? Thank you for coming. Appreciate it.
Thank you. Do you want us to leave this right here?
Yes, please. Yes, please. We are running out of time. Just summarize your...
Yes, I'm Pat McHugh, a retired teacher. I testified in 2004. Why are we still meeting like this? Every year, I have more and more out-of-pocket expenses. Last year, $7,343, and I'm relatively healthy. I have a number. I'm 77, so we're falling apart. 2009, $16,215, and I mean I've got I didn't go all the way back to 2004. Health insurance is not health care. Health insurance is denial of care. For that 20 or 30% that we are paying paper pushers and making money for these people, we could cover everybody in the state and do a better job. We could prevent illnesses instead of having them turn up in the emergency room. If health care was not tied to jobs, people would be freer to leave jobs that they don't like and even move, to another state for jobs that would be more preferable. Every week I get at least 2 mailings from United Healthcare, and most weeks 1 from Social Security. I mean, at 3 pages or so. Just think about the postage, the expenses, and this is just down the drain. And they tell me that they just paid a bill that was due in 2010. This is not a system. This is a non-system.
Okay, thank you very much. Everything's okay now?
Yes, sir.
Good.